Hi, my name is Ron Stankovich. Thanks for joining me, and we're going to go through a very general and very brief description on trauma-informed care. More importantly, for the purpose of this discussion, a more dignified, personal, and respectful approach to interacting with individuals who may have sustained trauma throughout their life or at one point in their life. To help put the impact of trauma on society in perspective, over 70% of adults in the United States have experienced at least one traumatic event. That's over 220 million individuals. And more than one-third of our youth who have been exposed to violence, either directly or witnessing it, will develop PTSD. For individuals who have experienced significant trauma in their past, the past can time travel to the future, or likewise in the future, an individual can time travel to the past, where the feelings, the fear, the anger, the need to escape, and a whole variety of other behaviors associated with trauma can manifest themselves currently in a situation with an individual who is in no way traumatizing the person, but there is some recognition, there is some feeling of feeling unsafe, and an individual will travel back to remember those feelings because it kept them protected to a degree in the past. And it's important for us to understand that a trauma reaction is not always necessarily directed at the individual, but it's a summation of their past experiences and their survival mode that has helped them to this point in their mind survive. How we talk to and the tone that we use in addressing someone who has been exposed to trauma in the past is critically important. We obviously don't want to hurt an individual. Asking questions that suggest the person is the problem or imply that. Judgments based on a lack of understanding or viewing a person through the lens of the issue versus the person themselves can be very hurtful. What helps is understanding or asking the person what happened as opposed to what's wrong with you. Knowledgeable and being aware of the role that culture, the individual's culture, as well as the overall culture, have in a trauma response and understanding trauma. And lastly, it's so critically important that we recognize an individual's symptoms is not an individual being disrespectful or rude, but it's a learned trait. It's a way that a person has made it this far in their life despite trauma. In other words, it's a way that they are coping as we all cope with challenges that we face throughout our lives. No one responds well to a judgmental person who is humiliating or harsh, disrespectful, critical, demanding. And on the other side of the coin, we have it all, as humanity, have a tendency to respond quite well to interactions where there's kindness and patience, calm, an atmosphere of acceptance, and most importantly, feeling heard can radically diminish the effects of trauma. And acknowledging a person's humanity starts with respect and dignity. And if we're not sure what that means, think of how you feel if an individual is respectful, asking for your help. Using simple words like please and thank you is such a great first step. Individuals who have been traumatized, the trauma can have a distinct and definite negative impact. If an individual has been traumatized and re-traumatized, there has a tendency to be a negative or hopeless view of world events. An individual can begin to believe that they are the problem, So in other words, who I am is the problem, as opposed to an individual who is facing a challenge and could benefit from support. And certainly spirituality can be determined by trauma. For some individuals, the belief is, how can there be a benevolent and loving entity out there when this has happened to me? Or for others can become overly religious, as that is their go-to, their hold on sanity and their grasp of some hope that may exist. It's important to understand that a symptom such as substance use, if we judge that as a snapshot in time without any other information, the view from many will be negative, to the point where a first person may feel like they are being discriminated against. I'd like to suggest that the symptom of substance use may very well be a sense of self-medication. It's a coping mechanism. An individual may have experienced physical trauma, domestic violence, physical violence. They may have experienced loss. There may have been abandonment issues. There may have been not having a safe place to live, not knowing where your next meal comes from. An individual can become overwhelmed, and all individuals will look to remove anxiety and pain. And some individuals will use substances to self-medicate the fear, the anxiety, the self-loathing. Does that make them a bad person? No. The individual is simply trying to survive. And someone who has a symptom of cutting, it's a release of pressure brought on by trauma. An individual isolating, removing themselves from society. It's avoiding of fear. It's avoiding of humiliation. It's an attempt to remain safe. And for someone who is aggressive or very assertive, they may feel extremely threatened at that point. And this is a mechanism of self-preservation. In a nutshell, stress, anxiety, fear, anger, trauma, this type of impact, it prevents our ability to respond, learn, and process external stimuli. The emotional upheaval that happens can be so overwhelming that it's hard, almost difficult to near impossible, without medical intervention, without therapy and work, for an individual to be able to handle stress and respond in a way that society feels is appropriate. But we need to remember that for that individual, they have been coping to the best that they can to this point in their lives. And it's not about what's wrong with you, it's about what's strong with you. It's not about who you were, but who you are, and how can we help them. In order to support someone with a trauma background, it's so important that we understand how trauma works, and that reactions to an individual is a usual response to an extreme situation. It feels normal to the person. It may not feel normal to the observers from the outside, but it's not an illness. It is a coping mechanism. It is a strategy. It is a way of life that is almost burned into the person's DNA based on past experiences, where it becomes an automatic response. Going back to the short circuiting of the ability to manage, these are responses that are now ingrained in a person's psyche. And triggers, such as some that we mentioned before, an individual, an event, a situation, an emotion, can result in a whole host of symptoms such as hyperarousal, flashbacks, fear, anger, an inability to make a decision, and oftentimes many withdrawing, are very common reactions to a situation that feels overwhelming and out of control. How can we help? We can help an individual grow past the effects of trauma by creating a safe environment, one that is non-judgmental. It's about listening without solving a person's problems. The only expert on this situation is the individual themselves. It's about helping an individual feel safe, asking for help. It's about developing trusting relationships. With that foundation, an individual can begin to form a positive attitude of trust, respect, and being treated with dignity. It's about listening to feelings in a non-judgmental way to help a person process. If an individual is triggered, how can we best support them? And there are some very basic, somewhat common sense and easy things that we can do. The first is being calm ourselves, verbally and physically. What does that mean? Watching our body language, keeping our movements slow and calm, watching the tone of our voice as well as the questions. Before doing anything, whether it be getting into an individual's personal space or even trying to help them, ask permission before you do anything. For example, would it be okay if I explained how this works? We mentioned just a moment ago respecting personal space. Do not get in an individual's bubble. Allow them to position themselves wherever they want in relation to you. Do not approach without permission, and certainly support an individual's exit strategy, such as don't get between them and the exit or between wherever they are hoping to go. Keep your comments very, very simple. The KISS principle. Very basic, very simple, non-threatening, and then most importantly, demonstrate understanding by using reflection techniques or active listening. There's nothing more frustrating for an individual who is triggered to feel they are not being heard. And throughout all of this, remember what's really, really important for an individual to feel safe and secure is to feel that they have some type of control through choices that they alone can make. We are not trauma therapists. One of the most important things we can do is to help an individual realize that the issue, the challenge, the anxiety at hand does not, in our minds, define the person. The person is the person. They are unique. They are special. They are wonderful. They have an issue, a challenge, and it's not about fixing the person, but simply inviting them into citizenship by saying, what happened and how can I help?